Chair is pleased to recognize the gentleman from Georgia, Mr. Carter, for your 5 minutes of questions.
Thank you, Madam Chair, and thank you, Dr. Shuren, for being here. Appreciate it. Dr. Shuren, way back in 2017, since that time, I've really appreciated your engagement on legislation that myself and others on this committee have authored to establish over-the-counter hearing aids. I'm a pharmacist by profession, and I see firsthand and have seen throughout my professional career the need for this. And I want to tell you that I appreciate your engagement in this. The agency proposed a rule on October 19th, as I understand it, of last year that got a lot of things right. And I want to thank you for that as well. Any idea when, or any indication that you can give us when the FDA might finalize this proposed rule?
And first of all, thank you for that provision. We couldn't agree more. These technologies very, very important for public health. We're supposed to, issue that 180 days from the end of the comment period, so that turns out to be about July 15th. And our goal is to do that. We know this is important to the administration. I can't, some of it's out of our control, but that is our goal, to try to meet that statutory deadline.
And you said it'd be what, June?
July 15th.
July 15th, okay.
Yes.
We look forward to that. I hope it'll be before then. I'll tell you, there again, my experiences lead me to believe and to offer to you that this is needed. I mean, we got reading glasses. I mean, we ought to have over-the-counter hearing aids. I get it if there's a need for more severe cases, but for most people, like myself, who getting on up there a little bit, you do need a little bit of help, and there's no reason why we shouldn't be able to do this. So I look forward to that, and thank you again for your work on that.
We agree. I will mention we received about 1,000 comments, so we want to make sure we get it right.
You received 1,000?
Yeah, about 1,000 comments.
Pro, con, or can you indicate?
Mostly pro. Some had suggestions. There are some differences of opinion, let's say, around where you set the output limits.
Right.
For example.
And I get that, and you're right. We want to get it right. We want we don't want to do them. I mean, the Hippocratic oath, do no harm. So we don't want to do that. But at the same time, we can help people, and we need to be doing that. Let me ask you about the FACTS Act, if you're familiar with that, the FDA Advancing Collection of Transformative Science Act. That is legislation that Dr. Burgess on this committee and I have co-sponsored, and it was considered at a hearing 2 weeks ago that we were in, and it has important ramifications about the medical device community and real-world evidence and clinical laboratory improvement amendments, CLIA, a waiver for EUA authorization and for EUA authorized diagnostic test. And of course, again, this is very important, and I hope that the committee will continue to move this bill forward. It is a very important piece of legislation. Will you commit to working and continuing to work as you have with this committee to improve and advance both the real-world evidence and clinical laboratory improvement amendments waiver provisions of this legislation?
We are happy to continue to, talk with folks through that. We are looking, I should tell you, in those transitions from an emergency use authorization to full marketing authorization, we're taking advantage of what's already, been provided. We will not, like for a CLIA waiver, we're not planning to ask folks to go ahead and do usability studies. There's no need. They've been out there. The biggest focus is really going to be on having enough data just to make sure that they work, because we relied on so little data to put them out on the marketplace.
Right. Good, good. Well, again, thank you. These are important issues, and thank you and the agency for your attention to these. And Madam Chair, I'll yield back.
Gentleman yields back.